With the HealthConnex program during the pandemic, it has helped us just tremendously. The program itself has grown through the pandemic to meet the growing needs of data that we needed, not only for surveillance, but then adding in all that lab testing that we were doing. That's something that we really haven't done in long-term care before. And how do we control all that information? So the lab module, and then the introduction of another auditing tool to complement the hand hygiene audit that was already in the program was a PPE audit, how you don and doff. It's such a complicated process, and breaking down those steps in that auditing process so that we could determine, where the needs, where the gaps were, and where we needed to follow up.
I can talk about data quality in general. Data quality is key, right? Whenever we're using a system, the system doesn't always solve everything for us. We know what information we need to capture, and capturing it correctly in our system allows for accurate outcomes, right? So input affects the output with systems. We're really solely focused on that with data because we are now able to pull aggregate data in order to support office level at a national level for all of our homes, and then regional and home level. We're really excited, and we're also focused on that key data quality piece, right? So making sure, and we're just re-educating if needed around any gaps we see in our data, right? From a clinical perspective and an IPAC perspective, looking at key pieces in the workflow that may be missing, right? Or information that the home may need to report out to public health. So I'll let Jean speak to that piece more.
The onset, and we're so thankful to HealthConnex for their innovations through it to make our life so much easier. Instead of having mounds and mounds of paper, and trying to sift through them before the introduction of the PPE audit, we would have like 6 inches of paper and have to sift through them and figure out our compliance, figure out our gaps. And now the audits are entered on the iPad, and just a click of a finger, instantaneously, we have those outcomes, those compliances. And it's just been an incredibly time savings for the homes in that data collection and analysis. And they don't have to report it now, because as a support to the homes, I can just go in and pull that aggregated data and report it up to the senior leadership team. And our care partners want to know what's happening in our homes, and we're able to pull that information out in so many different levels to meet those needs of reporting to our care partners, to our health authorities, and our public health support people. So we really appreciate the support that HealthConnex has given to our organization through this pandemic.